Hello everyone, I am Dr. Minal Kachhawa. I am MBBS MD from SMS Medical College and now an assistant professor. Today we are going to discuss physiology of deep sea diving. We are going to discuss the hazards of the deep sea diving, which includes the effects of the increased barometric pressures and effects of ascending back to the surface. As we know that the pressure at the sea level is 1 atmosphere, which is 760 mm of Hg, and this pressure keeps on increasing by 1 atmosphere when we go 10 meters into the depths of the sea. 10 meters or 33 feet. At about 100 feet of depth, the atmospheric pressure changes to around 4 atmospheric pressure, and as we do go down according to the Boyle's law, the pressure and the volume is constant. And as we go down, the pressure is going to increase and the volume is going to compress. So, for an example, as shown in this slide, at 10 meters, your atmospheric pressure has become 2 and the volume has become half. And at 100, your atmospheric pressure become 4 times that of the atmospheric pressure at the sea level, and the volume decreases or compresses to 1/4 of the volume at the sea level. Now coming to the hazards of the deep sea diving, the hazards includes the effects of the high barometric pressures and effects that happens when you ascend back to the surface. The effects that you see due to the high barometric pressures are nitrogen necrosis, high pressure nervous syndrome, symptoms, and acute oxygen toxicity and chronic oxygen toxicity. Effects of ascent to the surface includes dysbarism, which is commonly referred to as decompression sickness, and the air embolism. Now we'll discuss one by one each of them. The first one is the nitrogen necrosis. As we know, at the sea level, your atmospheric pressure is 760, and out of which your 80% is nitrogen and 20% is your oxygen. As we go down, the nitrogen levels and oxygen levels are going, the partial pressure of or the percent of oxygen and nitrogen in the air is going to be constant, that is 20 and 80%, but the pressure increases. As the pressure increases, the partial pressure of oxygen and partial pressure of nitrogen also increases. So at the surface level, this nitrogen is not soluble in the body fluids, and but when the pressure increases, this nitrogen tends to get dissolved in the tissue fluids as well as the fat. It has 5 times more solubility in the fats as compared to the body fluid, so it is more easily dissolvable in the fats, and fats are present in your cell membrane and your adipose tissues and your nerve tissues. Okay, so what will happen? This nitrogen will go and dissolve into these body fluids and these fats, and what they are going to do, it is going to, when it goes into the nerves, it will cause the slow conduction, which will eventually lead to the decreased excitability of the nerves. And this nitrogen symptoms gives you narcotic effects. This nitrogen necrosis starts at around 120 feet and it becomes more and more severe when you get beyond 250 feet. The symptoms of nitrogen necrosis are similar to that of the alcohol intoxication, and therefore it is sometimes also referred to as Martini effect. Now, symptoms that you see during nitrogen necrosis depends upon the depth and the atmospheric pressure. So at 120 feet, your atmospheric pressure is 4 to 5 atmospheric pressure, and at this depth you will experience euphoria, or the sea divers experience euphoria, impairment of the mental function and intelligence. At 150 to 200 feet, that is your pressure becomes 6 to 7. The diver become drowsy and there will be the poor muscle coordination. At 200 to 250 feet, the pressure increases further to 7 to 8 atmospheric pressure, and this leads to the fatigue, weakness and stupor. Above 250 feet, atmospheric pressure becomes more than 8 atmospheric pressure, and this leads to the deep necrosis and unconsciousness. Sometimes these symptoms of nitrogen necrosis are also referred to as the ruptures of the depth. The high pressure nervous syndromes that we discussed earlier is going to be managed by the helium and oxygen mixture. What and why do we prefer this helium oxygen mixture? Because helium is going to have the narcotic effect, but its effect is 1/5 of that of the nitrogen. And why this is happening? This is because the helium has the lower density and as it has low density, the work of breathing becomes less. It is also less soluble in the body fluids, and fast diffusion is there. Why it has fast diffusion? Because the size of helium is smaller than that of the nitrogen. So what will be the clinical features with helium? So helium will also have the anesthetic effects, and it includes tremors, drowsiness, and incoordinations. There will be depressed EEG activity, which will lead to the more of the alpha waves in the EEG pattern, and there is impaired manual dexterity. Now coming to the acute oxygen toxicity. Oxygen toxicity happens when 100% of oxygen at high pressure is given, and it is caused mainly by the oxidation of the polyunsaturated fatty acids that is present in your cell membranes, and also due to the generation of the free radicals. Your free radicals, which are generated by the cellular metabolism, are usually neutralized by the enzymes that are present in the body, that like your superoxidases and dismaltases. But when the oxygen becomes high in the, or the partial pressure of oxygen becomes more, what will happen? These superoxides या free radicals जो बन रहे हैं, that are going to increase in number, and जो enzymes which are present in the body are not enough to neutralize all of them. So there will be some free radicals will be present, and these free radicals are going to cause injury to the tissues and the cells. And whenever this will happen, what it will lead to? It will lead to the increased permeability of the cell membrane. So what will be the symptoms of the acute oxygen toxicity? It causes nausea, dizziness, irritability. There will be disorientation. There will be disturbed vision if it is going to affect your second cranial nerve, and there will be convulsions or seizures. O2 concentrations, when reduced to 20%, it can prevent the oxygen toxicity. So this is a diagram showing your oxygen in the blood by volume and partial pressure of oxygen in the lungs. So what is going to happen whenever your partial pressure of oxygen increases? That does not increases the generally does not lead to the oxygen toxicity. Because why this is happening? Because the oxygen hemoglobin dissociation curves achieves an plateau. Okay, so whenever there will be increased partial pressure of oxygen, no more hemoglobin is present to bind to the oxygen. So the oxygen hemoglobin dissociation curves achieves an plateau, and there will be no raised in the oxygen levels in the body. But what happens during the high barometric pressures? There will be increased dissolved oxygen, as oxygen is carried in two forms, your dissolved oxygen and with the hemoglobin. So the hemoglobin gets saturated, it does not increases after a certain time, but the dissolved oxygen that is present in the blood, that is going to rise, and this will lead to the total increase in the oxygen that is present in the blood, and this leads to your oxygen toxicity. That was your acute oxygen toxicity, and now we are coming to the chronic oxygen toxicity. When does it happen? It happens due to the prolonged exposure to the high atmospheric pressure, like 1.5 to 2 atmospheric pressure for around 8 to 24 hours. What are the symptoms of the chronic oxygen toxicity? It causes the bronchopulmonary symptoms. And what are the reasons for chronic oxygen toxicity? Same, due to the oxidation of the polyunsaturated fatty acids and increased free radical formations. So what is going to do? It is going to irritate the airways and may cause your nasal congestion, sore throat, sneezing and coughing. It may also lead to the pulmonary edema. As the permeability increases, fluid start developing into the alveoli, and it will lead to the pulmonary edema. And whenever there is edema of the alveoli, so what will happen? The gaseous exchange in the alveoli stops, and this will lead to the atelectasis, and it also can lead to the bronchopneumonia. So till now we have discussed what are the impacts of the high barometric pressures. Now we are going to discuss what will be the impact of the ascending to the surface. So the first one is your dysbarism or decompression sickness. Okay, decompression sickness or dysbarism can also be asked in the form of Cazen's disease, bends, chokes, diverse palsy or diverse paralysis. It occurs due to the sudden reduction of the pressure. So it is not going to happen if the person or the sea diver is coming back to the surface very gradually, but it happens when someone is rapidly and suddenly coming back to the surface. What happens? Due to the same law, Boyle's law, pressure, as the pressure decreases, your volume is going to expand. So whenever there will be increased volume and decreased pressure, जो dissolved nitrogen आपके fats के अंदर and आपके body fluid के अंदर होगा, वो अब escape करना चाहेगा. So what has happened? The nitrogen washout time in different body fluid and tissues is different. For your blood, the nitrogen washout time, half time is around 2 minutes. For muscles, it is 20 minutes, whereas in fat or adipose tissues, it is 40 minutes. So the dissolved nitrogen that is present in your blood is going to escape very easily through the lungs when your pressure decreases. But the nitrogen which is dissolved in the muscles and the fat, it is going to take time. So when a person ascend back to, very rapidly, what is going to happen? These nitrogen are going to come into the blood, and they are going to form small bubbles. And when these bubbles collide with each others, and these bubbles, when collide with each other, they are going to form large bubbles, and these large bubbles come into the circulation, and they may clog some of the arteries or the vessels, and wherever they are clogging the arteries or vessels, this is going to produce the symptoms of that tissue or that organ. So this is a diagram which is showing what is happening when the person is descending into the depths. What is happening at the before decompression? Oxygen levels, oxygen partial pressure is 1044 mm of Hg, and nitrogen is 3956. Total is 500 mm of Hg. So in this, your water vapor pressure is constant 47 mm Hg, CO2 is 40, oxygen in the body is 60, and nitrogen is 3918. Total becoming 4065. And what is going to happen when the person is ascending? जो बाहर का pressure है, that is decreasing back to the 760 mm of Hg, but the body pressure, it was around 4065. So nitrogen in the body is 3918, and when at the surface, nitrogen partial pressures is 601 mm of Hg. So what happened? The pressure moves from the higher pressure to the lower pressure. So nitrogen is trying to escape from the body into the atmosphere. So what is the mechanism of this dysbarism or decompression sickness? Whenever a person is gradually ascending, or sea diver is gradually ascending to the surface, the gas diffuses normally into the blood, and then it is expired out through your lungs. But in cases of the rapid ascent, the gas forms the bubbles in the tissues and the blood, and these bubbles are going to damage your tissue, and then it may lead to the pain. The symptoms of decompression sickness start appearing at the 30 minutes of duration. Clinical features of dysbarism is severe pain in the muscles and the joints, which is commonly referred to as bends. And in CNS, it may causes paresthesia, motor weakness, and paralysis. Why these things are happening? Because the nitrogen is dissolved in the Schwann cells of the nerves. So whenever it is going to affect the sensory nerves, it is going to lead to the paresthesia, and when it go and impact your motor nerves, it is going to lead to the motor weaknesses and paralysis. When those bubbles formed in the blood go and clog the pulmonary vessels, it leads to the dyspnea and respiratory compression. This symptom is often referred to as chokes, and when it impacts the heart, it may cause the myocardial infarction or ischemia. Management. How do we manage this decompression sickness? First one is your prevention, and second we are going to discuss about the treatment. Prevention. For prevention, what sea divers are suggested to do? They are suggested to slowly ascend back to the surface. That is, reduction of less than 50% of pressure is suggested, and the protocols of the US Navy is accepted worldwide for the ascending protocols. Treatments includes, if the dysbarism occurs, what you are going to do? You are immediately going to recompress the person in the pressurized chambers, which is known as decompression tanks. Then followed by the slow controlled decompression over the time, and person may also be given hyperbaric oxygen therapy. What hyperbaric oxygen therapy is going to do? It is going to replace the nitrogen with the oxygen. The first problem of the ascent was your dysbarism or decompression sickness. The other one is your air embolism. Now, why air embolism is happening? It is because when the pressure decreases, your volume is going to expand. So the volume that is present in your alveoli is going to expand, and whenever the volume is expanding, the alveoli will become larger and larger. To some extent, the alveoli will grow in get bigger in size, but after a limit it is going to rupture, and when they rupture, this air escaped from the alveoli can go into the pulmonary vessels and they may block it, and this leads to the pulmonary embolism, and this can occur at the shallow depths of 5 meters also. So to prevent all these things, sea divers are often using your scuba apparatus. What is scuba apparatus? It is a self-contained underwater breathing apparatus. What it has a tank and the wall system, and it contains the helium and oxygen mixture, which allow controlled inhalation and exhalation. This one is less toxic to the deep sea divers as compared to that of the nitrogen. हमने जो helium के जो effects हैं वो हमने पहले ही देख लिए थे, but it is 1/5 times less narcotic as that of your nitrogen. There are two type of scuba apparatus, your open circuit and your closed circuit. Open circuit scuba apparatus are those in which you breathe in the air from the apparatus and breathe out or exhale out the air into the surrounding. And the closed ones are in which the breathing in and inhalation and exhalation is happening into the mask of the scuba apparatus. This is a open circuit demand type of scuba apparatus. What does it has? It has cylinder which has the mixture of gas. It is a compressed gas, and the first valve, it has this valve is your reduction valve, which is used to reduce the pressure of the gas which will be delivered with the hose. And there is a demand valve. What will happen whenever a person is going to inhale, this valve is going to open, and with demand it is going to deliver the oxygen into the mask. Thank you.